Senator Thune and I had a motion that would have sent this bill back to the committee and required that everything in this bill start at the same time. So if the program starts in 2014, the taxes would start in 2014. Under our motion, not one dime in taxes would be paid before Americans are offered the insurance option in the bill. The motion was defeated. Now, the Democrats have revised their bill, and the taxes collected are even higher than the previous bill. Let's don't forget the penalties to business. Business that can't afford to offer health insurance to their employees. A tax of $750 per employee is assessed. Now, this is a time when unemployment has reached double digits. We should be encouraging employers to hire more workers. And yet this bill imposes $28 billion in new taxes on employers. What will these taxes do to small businesses, which create 70% of the new jobs in our country? In a letter sent to the majority leader yesterday, the Small Business Coalition for Affordable Health Care stated, with its new taxes, mandates, growth in government programs, and overall price tag, the Patient Protection and Affordable Care Act, the bill that we are discussing, costs too much and delivers too little. Any potential savings from those reforms are more than outweighed by the new taxes, new mandates, and expensive new government programs included in this bill. That letter is signed, in addition to the Small Business Coalition, by associations such as the Farm Bureau, Associated Builders and Contractors, Associated General Contractors of America, the National Association of Home Builders, the National Association of Manufacturers, the National Automobile Dealers Association, the National Retail Federation, and more. The National Federation of Independent Business, which is the voice of small business, sent a letter expressing their strong concerns over this bill. It says, the current bill does not do enough to reduce costs for small business owners and their employees. Despite the inclusion of insurance market reforms in the small group and individual marketplaces, the savings that may materialize are too small for too few, and the increase in premium costs are too great for too many. That's the tax situation. How about the $500 billion in Medicare cuts? They're still there. They were in the first bill, and they're there now. $120 billion in cuts to Medicare Advantage, which we know reduces choices for seniors. In my state of Texas, over 500,000 currently enrolled enjoy the benefits of Medicare Advantage. That's just in my state alone. Millions across the country like Medicare Advantage. But many seniors, without a doubt, are going to lose this option. Now, oddly enough, once again, one of the points in the new bill is that there were opt-outs for certain states on Medicare Advantage's cuts. So some states are going to have the Medicare Advantage cuts, while other states will not. The individual fixes for certain states, presumably to get the votes for certain senators, really, Mr. President, does not pass the test of transparency, if you put it in the nicest way. It just doesn't pass the test for fairness, for due process and equal treatment under the law, and it certainly doesn't pass the test for what is the right way for us to pass comprehensive reform legislation. The other health care cuts in Medicare would be $186 billion in cuts to nursing homes, home health care, and hospice providers. And then there are the cuts to hospitals. Approximately $135 billion in cuts to hospitals. The Texas Hospital Association has estimated that hospitals in my state will suffer almost $10 billion in reduced payments. I have a letter from the Texas Hospital Association that outlines their concerns with these cuts and this bill, and they are very concerned. Here's one of the quotes from their letter. The Texas Hospital Association says, with a significant reduction in payments, hospitals may be forced to reduce medical services. Hospitals may be forced to close or merge with another hospital or severely reduce the services they provide to their communities. Essential services such as maternity care, emergency services, medical surgical services, or wellness programs may be reduced or eliminated entirely. Mr. President, I know I've talked to so many hospital administrators and people in hospital boards, and they are very concerned about the cuts in this bill because they are on very thin margins, most of them. They're struggling, and especially in our rural areas, and they are very worried that there are going to be shutdowns of hospitals throughout our state and certainly our country. But our aging population is growing, so cutting payments to providers who treat those, whether it is in hospitals or healthcare providers, doesn't seem to be a way to reform Medicare. Cuts in Medicare, and especially the payments for treating low-income seniors, will disproportionately impact rural hospitals, which are the safety net for health care outside of the metropolitan areas. The Texas Organization of Rural and Community Hospitals, which represents 150 rural hospitals in Texas, said in a letter, "We fear the Medicare cuts as proposed could disproportionately hurt rural hospitals, which are the health care safety net for more than 2 million rural Texans. Because of lower financial margins and higher percentage of Medicare patients, rural hospitals will be impacted more than urban hospitals by any reductions in reimbursement. These proposed Medicare cuts could have a devastating effect that could lead to curtailing of certain services, and the closure of some of these hospitals in Texas is a real possibility." How could anyone support a reform bill that will result in seniors having to drive 30, 60, and 90 miles and more to get the care they need, care that was accessible in their own community before this bill took effect? Mr. President, what we have here is a bill heavy with tax cuts, tax hikes, Medicare cuts, and government intrusion. This bill is being forced through Congress the week of Christmas because everyone knows that this is not the reform that Americans want. The polls are showing that. We all know that polls can have margins of error and maybe they're not completely accurate, but the trend in the polls is clear. It has gone from people thinking that health care reform is a good thing and supporting it in majorities to going down now to the point where the trend is clear. The American people now do not support this bill. They would rather have nothing, according to the latest polls, and have Congress start all over and do what they hoped it would do, and that is bring down the cost of health care, not have this big government increase in debt, cuts to Medicare, and increases on taxes to small business and families, especially at this time in our country's economic period. My Republican colleagues and I have tried to offer fiscally responsible alternatives to reform, allowing small businesses to pool together, increase the size of their risk pools will bring premiums down. If you have the exchange with the risk pools that are increased, it would be fine unless you have so many mandates like we see in this bill that are going to cause the prices to stay up and even get bigger because of all the taxes on the underlying companies that are providing the health care. Creating an online marketplace free from mandates and government interference would be a Republican proposal, something that I think would be a point at which we could start having health care reform that would be truly effective for America if you didn't have the mandates that would drive up the cost. Offering tax credits to individuals and families that purchase insurance on their own. That's a bill that we have put forward. $5,000 per family would cut the cost and make it affordable without any government intervention that would be necessary. And of course, medical malpractice reform could take $100 billion out of the cost of health care by stopping the frivolous lawsuits, or at least limiting them. Yet, Republicans were really not at the table. The bill was written in a room, no transparency, no C-SPAN cameras, and no Republicans. We did not have input into this bill. That's why it is a partisan bill. That's why the vote last night, or this morning at 1:00 a.m., was completely 100% partisan. Because why would a Republican vote for a bill that goes against every principle that we have, higher taxes, higher mandates, and cuts in Medicare, and in which we had not one amendment pass? We offered amendments, but there were hundreds of amendments left on the table that we were closed out of offering because of the rush to pass this bill before Christmas. Mr. President, Americans asked for reform. They deserve it. This bill is not the reform Americans hoped to get from a Congress that would have acted responsibly but did not. Thank you, Mr. President, and I yield the floor.